Hello, namaste. My name is David. This gentleman here is also David.
Hello.
And we're going to have a little discussion about what is the healing process, or what we term in yoga as rejuvenation, which is our ability to make ourselves grow younger instead of giving in to the aging process. So we'll start with David, who at age 70 is been told, well, it's because you're old and you can expect to have all these problems and diseases, etc. I'm 7 years older than David, and I don't have any of these diseases. I don't have the aging process, and biologically, DNA testing has shown that my cells are actually at age 48 or mid 40s somewhere, not 77. So, David, tell us your story of how did you come to have many diseases,
Yeah.
which the worst one, which is ALS, which is terminal. You die from that one. Eventually, you can't even breathe anymore, and you suffocate, which is not a nice thing to be looking forward to, but that's what he was told was going to happen. So, tell us a little bit about your story.
Yeah. I've in the last 10 years of my life, I've been affected by a number of cancers, two, which I've overcome um, through pretty strenuous clinical and rehabilitation process, which so far have been addressed. I'm in remission. But about a year ago, um, I started noticing some more noticeable degenerative effects affecting first of all, my legs, and then my ability to balance, and then my hands, the ability to actually grasp things and control my hands. And it's not lack of feeling, it's actually my brain not being able to communicate with my muscles so they do the things I want them to do. And that gradually progressed over the last 6 months. And I used to say, also add that in the past year, I've been subjected to quite a bit of chronic stress and fatigue as I was looking after a loved one myself, and that was a very stressful
Stressful.
and fatiguing
Yeah.
process. Anyway, through the process of trying to get to the bottom of why am I feeling this way, um, I um, I went to see my neurologist, and he basically sent me for some tests and said, "I'm not sure what's going on with you. Let's send you to another neurologist." And so on and so forth. And then that neurologist said, "It's strange, we're not understanding why this is happening to you. You don't present as the kind of person that would normally be subjected to a lot of the other um, similar diseases, which are autoimmune type diseases." So they sent me to an ALS clinic, a center clinic that specializes in the diagnosis and, well, I should say a motor neuron disease clinic. Specializes in trying to diagnose and figure out what of these diseases you have, or is it something else. I should also know that although in the last um, 5 6 years, I'd watch what I'd eat. I'd do moderate exercise, mild, uh, like exercise, maybe walking, up to 5 kilometers a day. And then all of a sudden, around 6 months ago, I could only walk maybe a kilometer and a half before being too fatigued. My legs wouldn't move me any further, And I also started developing an arch where I was starting to curl over my my neck, developed severe pain, and so did my lumbar area, lower back. So I wasn't a happy camper, and went through multiple MRIs. I can't remember how many X-rays, blood tests, various different kinds of tests, all to try and find out a marker that would indicate you've got this disease. They couldn't find anything that was specific. They just said, well, the waveforms that we're getting from your electrical muscle stimulation testing tell us that your motor neurons are not working properly. And at first, they were focused on the lower motor neurons because of the legs and the hands. And then at the last point, when I don't think they'd figured out what other tests they could run, they did some more tests and said, well, it looks like you've got upper motor neuron issues too. Although I don't have any problem, didn't have any problem with speech, which is one of the key indicators of that. So they said, therefore, we've come to the conclusion that you have ALS. And I said, okay, what can you do for me? And basically said, there's no cure. There may be a couple of medications that can help slow down and prolong your life by 3 to 5 months at most. But basically, you're looking at life expectancy on average between 3 and 5 years of gradual degeneration of your capabilities of actual movement. You will end up not being able to walk. You'll be confined to a wheelchair. Then over a period of time, your breathing will become difficult. We may have to introduce some mechanical form of breathing. Eventually you'll be bedridden, and then essentially you die because you suffocate, because the nerves don't control the
breathing.
the muscles anymore. Even like the vagus nerve and stuff like that, which controls the breathing, the subconscious operation of your body.
So I just intervene. Some of the symptoms that you're talking about also are very common with multiple sclerosis, which is the motor neurons are deteriorating. Actually, they're being eaten and chewed at by your own immune system, which destroys their ability to send the impulse to a muscle that you want to use. So slowly you lose your abilities everywhere in your body. With ALS, it goes more central and goes into the motor neurons that make your breathing happen and make your heart beat. So you're right down at the center. And when that stops, of course, like I said, you suffocate and you can't do anything. You can't breathe anymore. So you're suffocating still in your body. And you mentioned the mental aspect is still very sharp. And David's very sharp mentally, no problems at all, but a lot of physical degeneration. And then we didn't mention in all these testings, they came up with he has facet joint osteoarthritis. He has end plate thickening or bursitis, spondylitis, spondylitis, femoral stenosis, radiculopathy. These are all the different diseases that they have diagnosed he has, and for which there is no real solution. It's just
no, and that's correct. Those diagnoses are a result of them looking for other reasons why I may be having motor neuron issues, and I was pressing them for make sure you do your investigations, and I was the kind of patient that said you do whatever tests you need to do to try and figure out what's going on. I went through a lot of tests. I mean, in the last 6 months, I've had a number of MRIs. I've had multiple X-rays. I had blood work done every month for and other more complex um, clinical investigations of various aspects to try and narrow it down to what is causing the impact to my motor neurons. And I think, as I mentioned at first, it said we see issues with your electro ECG tests for the nerve tests, the electrical tests, with your lower motor neurons, and then they said, but we don't see anything with your upper motor neurons. And then they did more tests and more tests and more tests. I think they were looking for a problem, and they said, well,
Yeah, well, they
now
do
we're
that.
seeing something with your upper motor neurons, and they were sticking needles in my ear, in my tongue, looking for waveforms. And I said, well, my understanding is you can't just go by waveforms. And they said, well, there's other factors, but when you press them, they wouldn't say. And they asked, well, how did I get this? And they said, it's sporadic. We don't know. Because some people get it. Unless you've got a gene which is passed through the
Mm.
family, which is called a familial version. 10% of people that get ALS or diagnosed with ALS can have it from this gene, and I don't have it. So as we said earlier, I said, okay, so what can you do for me? And basically, he said, we can just give you these two medications to help you help slow down the damage to the motor neurons. But other than that, as we said previously, you've got 3 to 5 years on average to live, and there's nothing else we can do. I asked them about, well, how can I rebuild my muscles? And they said, no, that won't work because of your age, and we don't want you doing any significant exercise because that can make the motor neurons damage,
Deteriorate.
progress, and they'll deteriorate faster. And so I left in a pretty gloomy, doomy prognosis of what my life is going to
Mm.
be, trapped inside a body that doesn't work anymore, but yet having all my mental capabilities. Uh, a real scary thought, not one that I would want on anybody.
Yeah, it's not very hopeful. In fact,
No.
it's hopeless.
And so I asked about, well, what about complementary alternative medicines? Because when I went through my cancer treatment, I did a lot of reading about foods that can help and other aspects, and delved quite deeply into the various reports of things that may help. And then one of the things that came up was, well, yoga might help, and I think the yoga was helped more with the stress, because stress does affect your health a lot more than
Mm.
we appreciate
Yeah.
at
Well,
times.
they are realizing that stress is a
Yeah, and
big important thing.
I've always I've always had stressful career positions, and as I said, the last year before I was starting to notice the disease was very very stressful and fatiguing upon me. Anyway, yeah. So what do you do? Go home and prepare to die, or do you actually start looking at things and challenging what you've been told? The medical profession doesn't like it when you challenge them or ask for data to prove their diagnosis. And being an engineer by profession, that's something that we insist upon. Maybe is
How does it work, and
yeah,
what's
how does it work? Why is it not working?
yeah?
What do we need to do to fix it? Well, what do we
Yeah.
need to do to fix me, David? And I wasn't getting the answers. So as I mentioned earlier, I'd done some research and I saw yoga was one of the things that mildly it was the ALS Society actually that put yoga down as may help. So I started on my journey to find out about yoga, and luckily I have some good family connections, and they said, yeah, and was pointed towards David's direction, and learned more about what he'd achieved with his patients, clients, however you want to call patients, clients,
Yeah, well, I think in terms of students, because I
students.
I teach people
That's
how
right,
to
you
become
do.
healthy. I don't heal anybody. I'm not healing you.
No,
I'm just
I'm
teaching you
teaching you.
what you do, and you're doing it, and you're getting results, just like these other people. And
Perfect.
I've dealt with a number of people who had terminal cancer, and it just went into remission in a short period of time, just weeks, and it went away. It goes away and it stays away if you follow the right lifestyle. So the same thing with David here. When he came, he was not in very good shape, difficult to walk, and what I could see is his hands were pretty locked down, and his neck was bent. He could
Yeah.
hardly lift his head. And I have seen everything is improving. And we started with the breath. I taught him how to breathe. And at first, just doing the abdominal breathing, his belly didn't move at all. The midsection breath didn't move at all. Now that's moving some. The abdominal is doing great. I think he's getting a full abdominal breath, and the upper breath is working. His breathing has gone from maybe 10%, which is the maximum he came here with. Now he's probably at 60% or 70% of his lung capacity, and we're increasing.
Hmm.
And as that is increasing, everything else, the hands are opening up, straightening.
Yeah.
He's walking much better. He can, when he gets a little tired, he stops and does some breathing, and the tiredness goes away, and he can keep going. So a lot of improvements in many areas, and it's again, this is part of yoga. Is that you're not targeting? Oh, he's got his neck is bent. He's got an osteoporosis problem here. Um, it's yoga heals everything. Everything is working together. The whole body is one unit, and when you start giving the body everything it needs, oxygen primarily, and then circulation. So movement with oxygen and breathing creates a whole new attitude physiologically, and your body begins repairing itself. It's designed to do that. It knows how to do that. This is one of our subconscious programs, healing, just like heartbeat and breathing. They're programs that are already there. So we can go in and update, upgrade the program, make them work better. This is what we're doing, and there's been all kinds of improvements with David's health. And he's been here for 1 month. He's got another month to go. We're doing weight training. His muscles are getting a lot stronger. He's doing a lot more of all of the exercises and feeling good about it. When tiredness comes in, sit down, do some breathing. Okay, I feel better. So, seeing a lot of very positive changes.
The breathing really makes a difference. It gives you energy that I was
Yeah.
just lacking. I just didn't have it before, and that energy then pushes you to do things like movement. It allows you to do things like movement, where before I
Yeah.
was so stiff and rigid,
Yeah.
and things like just basically curling up, preparing to die. And I'm not like that now at all. And I can walk with my head up for quite some distance now. Before I couldn't do that, my head was always dropped down like that, and I can move my head a lot more. The movement there is a result of going through the breathing, doing the exercises that David is teaching me, and you get that's helping move the fluids around in the body and stuff like that, so they can address some of these uh, both nervous system and musculoskeletal deficiencies
Yeah.
that I've
Calcification, as you were calling
calcification. Yeah,
it, which is
yeah,
creeping in everywhere, makes you very stiff. And I've seen everything from the hands to his spine is bending. It was hardly bending at all in the beginning. The ribs were not moving much at all. So everything is moving. He's breathing deeply. Everything is moving. Circulation is increasing, and he's feeling better. Every day he sees progress, and we've seen a fair amount of progress in 4 weeks, and we got 4 more weeks to go. So now we can go faster
Yeah.
because he's breathing better. His carburation is better. So we keep
Well, I have a vision of success, David. At the end of this, I'll
yeah
be able to go on and
play golf.
I'll play golf. Yeah, I'll be
Yeah,
able to, walk on that golf
walk.
course
Yeah,
and swing that clubs and whack the hell out of that golf ball, and
yeah.
that's one vision of success. But it's very easy to give up when you're just told things like I was told.
Yeah. Well, yeah, it's hopeless.
My nature is don't accept the status quo. Not a lot of people, not everybody's like that. But have faith.
Yeah.
There are things you can do.
Yeah.
And if you don't try, you don't get. And yes, there is no gain without a little pain. But I tell you,
Well,
this is far better, moderate pain, because you see the progress of going around. The alternative is much worse.
yeah. So in David's case, because he hasn't been like me, 55 years of doing yoga, for David, it's a new thing. So his body has stiffened. We have to make it more flexible. And that process of making it more flexible isn't always pleasant. So you have to make yourself push yourself a little bit more, do a little bit more, and then it starts to feel okay, and then it starts to feel pleasant, and it's more enjoyable. Moving, doing things in the world with your body becomes enjoyable again.
Yeah.
So that's the road we're on, and we'll give you another update later on because we are progressing daily. And
Thank you,
let's
David.
let's carry on. Thank you. Thank you for doing this, and thank you for sharing your story.
Yeah, I'm
Hope it
happy to share.
inspires a few people.
Don't give up.
Yeah. And my teacher in India many years ago, Dr. Swami Gitananda, said many times when I was studying with him, that there is no such thing as an incurable disease. And he was a medical doctor for 38 years. Then he went back to India and started a yoga school because that's where he began his life. Okay, that's where I learned.
Yeah.
Thanks for listening.